In this video, I will do a full breakdown of the levator scapulae muscle, a main cause of chronic neck pain and tension in the traps. Expect to learn the function of the muscle, clinical presentations when dysfunction is present in the muscle, detailed palpation instruction, and functional-based treatment demonstrations. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, sciatica, and hip pain. My focus is on finding and fixing adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the soft tissue treatment revolution, where we teach overworked massage therapists a new treatment system that will allow you to double your income, all while working 50% less so you can stay healthy, avoid that dreaded burnout, and help more people get out of pain for good. All right, so levator scapulae muscle breakdown. I'm just going to call it levator scap for the rest of the presentation, function, clinical presentations, palpation, and proper treatment demonstrations. Let's get right into it. So the function of the levator scap, number one, the name itself. It elevates the scapula. It also internally rotates the glenoid cavity. It is very important in cervical spine stability, also produces lateral flexion and extension of the neck. It does a lot of work and it gets beat to hell in a lot of people that have chronic neck pain and tension. So some common injuries associated with a levator scap problem. One is just going to be neck pain and stiffness. So, the levator scap does a lot of work, as I showed on that earlier slide. And when this happens, one of the areas where it really gets beat up is in that cervical spine stability. It's really not wanting to be the main one to do that, but it ends up having to do it a lot. And when that happens, it gets overworked. It's constantly stretched and contracted. When this happens, it doesn't get enough blood flow, doesn't get enough oxygen, causes the muscle to start laying down adhesions like a glue that gets inside there, makes the muscle weaker, less flexible, in turn puts more pressure on the neck, and then the neck has to just be almost like in a vice every single time throughout the day. Also, cervical disc injury. So when that levator scap is loaded up with a lot of adhesion, puts more pressure on the joint in the neck as well, and can produce problems on the disc, causing herniations, bulges, protrusions, everything you can think of for cervical spine. A lot of times when people wake up with that feeling of, oh, I must have just slept on my neck wrong, a lot of times what happens is there's dysfunction in that levator scap and it can't stabilize the neck how it's supposed to. So it puts more wear and tear on the disc. The disc starts to get inflamed, gets irritated. And when that happens, the client kind of locks up and can't turn their head. The sleep wasn't the problem. It was everything else that built up. Also, tight traps. Anytime I see a word like tight, people usually think, oh, I just need to stretch it. My question is always, why is it tight? We must answer that question. It's tight because it has all of that adhesion in there. Then the last one is just upper cross syndrome. I really don't like any diagnosis with syndrome in it. It's really just a code word for we really don't know what's going on. Any diagnosis should have a tissue specific problem with it. This doesn't. But essentially, what happens is they say, with bad posture, looking down, looking forward, some muscles are tight, some are weak. Yeah, they are. But why are they tight and they weak? You have to address that. So you can't just simply be like, let's do this stretch or let's work this area. We have to figure out where that problem is in the first place and know exactly where to go. So if you're going around telling your clients they have upper cross syndrome and they need to stabilize these muscles and do this and do that, you're not really giving them any answers. You're not getting to the root cause of what's going on. So how to find the levator scap? It's a really important muscle. And a lot of times they actually have it wrong in some of the anatomy books. They have it kind of going down and to the side like a J. What it does is it actually goes down and like straight back and then goes into that superior angle. When it's dysfunctional, you're going to find it. A lot of times if you have a client that's coming in for neck pain, the chances of them having adhesion buildup in the levator scap is pretty high, and you're going to find it as well. So what I want to link up first in the video this week is some tools and tactics that I use and some landmarks to help find that levator scap every single time, because I always say if you can't find it, you can't fix it. So I'm going to link that up right now. The key is going to be to find where that levator lives. So a lot of times in the anatomy books, they have the levator coming out and making like a weird J motion in there. It doesn't actually do that. It actually goes straight back and straight through. So the way I find where the levator goes is I usually find from that superior angle of the scapula and go through here. And a trick that I do is I bring the neck back, and you see how it creases in here when we bring the neck back. That allows me to get my landmark of where I want to go. So that's a little trick that I do. So now we know that, and I'm going to be there. So just a couple of take homes from the palpation video. Just slow down. Don't be in a rush. You know, so many of us, and I've done this myself over the years, is we just want to jump right into the treatment, find that spot and just get going. You know, if you slow down, you find it, you take the time to get it, you know you're going to be on it every single time. What they always say in like construction work, you know, measure twice, cut once. Same thing, palpate twice, treat once. You know, this is the difference between having to do a lot of work or just doing the right work. Less wear and tear on you, less damage to the client, better effective treatment. Everybody wins. So how to effectively treat it? You know, I talk about this in almost every video that I make. Slow, precise, focused. You know, so much of treatment out there is what I call a shotgun approach. You just do a bunch of shit. You use your elbow. You might dig in there really deep. You don't have that fine touch. The thing about adhesion is it doesn't need a ton of pressure. It needs the right amount of pressure and then the right amount of tension to break it down. So you want to use those landmarks like I talked about in the palpation video. You want to be able to find it. Use the neck crease. Use the superior angle of the scapula. When you do that, it's going to set you up for success every single time. You're going to be able to treat the muscle that needs it and make the biggest change. So what I want to link up next in the video is a treatment demonstration of me breaking down adhesion in the levator scap muscle. I'll link that up right now. And I'm going to be there. And what I'm going to do is have the client bring their head back just like this. And now I'm going to go through my motion and my palpation. And then when I'm ready, the client is actually going to drop their head down very slowly into flexion. And this is called internal slide on the tissue as we go. We're going to go nice and slow. So one thing I like to do for the levator is I like to come at like a 45-degree angle in through here. 45-degree angle as we come through. So what I'll do is I like to use my outside hand, and it's here, and then I find that crease in the neck, then I know where I'm at, and it puts that muscle in a shortened position. Now I come through, I approach here, my outside hand is right on the top here, and then my inside hand is here, and that actually backs it up. And I create what's called like a lock-in key, where my thumb goes in there and protects it. So I'm here, just like that, and then I'm going to come in like that, and I'm nice and relaxed. And the first step that I'm going to do is I'm going to go up on my toes, and then I'm going to sink straight down to the floor. And that's what's called my first depth as I go. Now my second depth is going to be with this non-contact hand. I'm going to get in there and do a pec push, just like that, and that gets me more depth. Then I'm going to back out about 5 or 10%. And the next thing I'm going to do is pull my lats back like that. And then I'm going to do what's called a hip hinge and drop my butt back like that. And that increases my tension. Now it's loaded. And now I have the client drop their head very slowly. And as they're dropping their head very slowly, I'm keeping my depth and dropping my butt back as we go and keep going, keep going, keep going, until they reach down and touch their chest. This area is very dysfunctional, but you have to account for the different changes in the anatomy and where you are. And you can see how deliberate I am. I come in at 45. It's a very slow and in-depth process as we go, as we're generating the tension and going in there. But if you can effectively find and fix scar tissue in here, what that's going to do is decompress the neck and take a lot of pressure off of the discs and the joints in the neck. And this area is usually very beat up, and a lot of therapists want to get in there like with their elbow, or they want to get in there and be too compressive. And I always say, if you're treating scar tissue, think of it as like a rubber band. And if I put a rubber band on the floor, I can jump on it, I can drive it over with a car, it's not going to break. What actually breaks it is that tension, and that's what we teach, is getting proper depth, then tension, using your body so you can work, what do I always say? Work smarter, not harder. So that's the levator scap video. So a couple take homes from the video. It's always proper depth and then tension. You want to feel the tissue slide. A lot of people look at this and they're like, oh, it's just pin and stretch, or it's myofascial release, or maybe it's ART. Sure, I guess. But the difference is in the details, getting it just right every single time. What I find is that most providers are usually too compressive, and then that doesn't allow the tissue to slide. It hurts like hell when you're doing it. The client thinks that it's doing something. It temporarily feels better because you're stimulating some nerves and getting some things to relax, but it's not fixed. And then they're coming back a week later, 2 weeks later, they still have all this tension, all this in here because you didn't effectively break down the adhesion because you didn't get the mechanics right. So proper depth, then tension, have the client go through a full range of motion. And you never want to do more than 5 to 7 treatment passes on this area because it's usually a wreck on people. And most people also have some cervical spine involvement there as well with the discs and the joints and everything like that. And if you do too much treatment, it can actually make it a lot worse and cause more problems. So all I got for you in the video. Appreciate you watching. If you're struggling to figure out exactly what's going on with your client's injury presentation, you feel like you're stuck guessing and always on a path to try to learn some new type of advanced technique from some guru out there or some expert that isn't really an expert, only to be stuck in the same loop of winging it and trying more stuff, taking more courses, then go download our free training modules that help change the way you think critically and how you think about it and how you figure out the issue, and really just treating in a new way that gets long lasting results and get on the path to being a true problem solver. Links to all that can be found in the description below. I appreciate you watching, and I'll see you on the next one.